details to show how much you mean to us. We are moving forward, innovating our touch of care. Making us available at any hour, at any day. So we can be more responsive. So we can be more connected. This is how we make the future of healthcare special. By making you experience you are special in every sense. We go beyond care. Experience MaxiCare today. MaxiCare Primary Care Clinic VGC is open to care for you 24 hours a day, every day. Visit other MaxiCare primary care centers at these locations.
Pag biglang nagkasakit, sagot ka ng eReady. Ang first prepaid emergency health card from MaxiCare. Sagot ang anumang sakit, sagot din ang sakit sa bulsa. Pag emergency, sagot ka ng MaxiCare eReady. Pag na-aksidente, sagot ka ng eReady, ang first prepaid emergency health card from MaxiCare. Sagot ang sakit ng katawan, sagot din ang sakit sa bulsa. Pag emergency, sagot ka ng MaxiCare eReady.
Can bring you luck or change your luck. Fight the 8 deadly diseases: dengue, malaria, pneumonia, and more. With My MaxiCare Lite, the one-time prepaid health card for hospital confinement due to the 8 deadly diseases. So luck is always on your side. Fight the 8 with My MaxiCare Lite.
Si Mama, unlimited ang pagmamahal. Kaya unlimited din ang pasasalamat ko sa kanya. It's time to give back with MaxiCare Primo Gold, the affordable prepaid health card for senior citizens.
Kanina pa masama yung pakiramdam ko. Obo. Sipon. Masakit ang ulo. Nilagnat na rin yata ako. Sa tingin ko, hindi ko na kaya pumunta sa ospital. Dok, anong gagawin ko?
First of all, you really need to rest. Kailan nagsimula ang pananakit ng ulo at pag-ubo mo?
Kahapon pa po ng umaga, Dok.
Na-check mo na ba temperature mo?
Care is just a call away. With MaxiCare's 24/7 teleconsult service, every MaxiCare principal member and their dependent gets free expert medical consultation from reliable MaxiCare partner doctors anywhere at any time.
Sa MaxiCare 24/7 teleconsult service, ang alaga parang nariyan lang. MaxiCare.
What makes a future special? Perhaps it's in what you see. And how we see it. What you hear and how we listen. And if you seek a future that's worth depending on, we've got you covered in every way. We even added a little cup of comfort. And tasteful little details to show how much you mean to us. We are moving forward. Innovating our touch of care. Making us available at any hour, at any day. So we can be more responsive. So we can be more connected. This is how we make the future of healthcare special. By making you experience you are special in every sense. We go beyond care. Experience MaxiCare today. MaxiCare Primary Care Clinic VGC is open to care for you 24 hours a day, every day. Visit other MaxiCare Primary Care centers at these locations.
Pag biglang nagkasakit, sagot ka ng e-Ready. Ang first prepaid emergency health card from MaxiCare. Sagot ang anumang sakit, sagot din ang sakit sa bulsa. Pag emergency, sagot ka ng MaxiCare e-Ready. Pag na-aksidente, sagot ka ng e-Ready, ang first prepaid emergency health card from MaxiCare. Sagot ang sakit ng katawan, sagot din ang sakit sa bulsa. Pag emergency, sagot ka ng MaxiCare e-Ready.
Can bring you luck or change your luck. Fight the 8 deadly diseases: dengue, malaria, pneumonia, and more. With My MaxiCare Lite, the one-time prepaid health card for hospital confinement due to the 8 deadly diseases. So luck is always on your side. Fight the 8 with My MaxiCare Lite.
Si Mama, unlimited ang pagmamahal. Kaya unlimited din ang pasasalamat ko sa kanya. It's time to give back with MaxiCare Primo Gold, the affordable prepaid health card for senior citizens.
Kanina pa masama yung pakiramdam ko. Obo, sipon, masakit ang ulo. Nilagnat na rin yata ako. Sa tingin ko, hindi ko na kaya pumunta sa ospital. Dok, anong gagawin ko?
First of all, you really need to rest. Kailan nagsimula ang pananakit ng ulo at pag-ubo mo?
Kahapon pa po ng umaga, Dok.
Na-check mo na ba temperature mo?
Care is just a call away. With MaxiCare's 24/7 teleconsult service, every MaxiCare Principal member and their dependent gets free expert medical consultation from reliable MaxiCare partner doctors anywhere at any time. Sa MaxiCare 24/7 teleconsult service, ang alaga parang nariyan lang. MaxiCare.
What makes a future special? Perhaps it's in what you see. and how we see it. What you hear and how we listen. And if you seek a future that's worth depending on, we've got you covered in every way. We even added a little cup of comfort. And tasteful little details to show how much you mean to us. We are moving forward. Innovating our touch of care. Making us available at any hour, any day. So we can be more responsive. So we can be more connected. This is how we make the future of healthcare special. By making you experience you are special in every sense. We go beyond care. Experience MaxiCare today.
Pag biglang nagkasakit, sagot ka ng e-Ready. Ang first prepaid emergency health card from MaxiCare. Sagot ang anumang sakit, sagot din ang sakit sa bulsa. Pag emergency, sagot ka ng MaxiCare e-Ready. Pag na-aksidente, sagot ka ng e-Ready, ang first prepaid emergency health card from MaxiCare. Sagot ang sakit ng katawan, sagot din ang sakit sa bulsa. Pag emergency, sagot ka ng MaxiCare e-Ready.
Can bring you luck or change your luck. Fight the 8 deadly diseases: dengue, malaria, pneumonia, and more. With My MaxiCare Lite, the one-time prepaid health card for hospital confinement due to the 8 deadly diseases. So luck is always on your side. Fight the 8 with My MaxiCare Lite.
Si Mama, unlimited ang pagmamahal. Kaya unlimited din ang pasasalamat ko sa kanya. It's time to give back with MaxiCare Primo Gold, the affordable prepaid health card for senior citizens.
Kanina pa masama yung pakiramdam ko. Obo. Sipon. Masakit ang ulo. Nilagnat na rin yata ako. Sa tingin ko, hindi ko na kaya pumunta sa ospital. Dok, anong gagawin ko?
First of all, you really need to rest. Kailan nagsimula ang pananakit ng ulo at pag-ubo mo?
Kahapon pa po ng umaga, Dok.
Nag-check mo na ba temperature mo? May ininom ka-
Care is just a call away. With MaxiCare's 24/7 teleconsult service, every MaxiCare Principal member and their dependent gets free expert medical consultation from reliable MaxiCare partner doctors anywhere at any time.
Sa MaxiCare 24/7 teleconsult service, ang alaga parang nariyan lang. MaxiCare.
Puro advertisement.
What makes a future special? Perhaps it's in what you see. And how we see it. What you hear and how we listen. And if you seek a future that's worth depending on, we've got you covered in every way.
Sunod na.
Ito, fried chicken half.
We even added a little cup of comfort. And tasteful little details to show how much you mean to us. We are moving forward. Innovating our touch of care. Making us available at any hour, at any day. So we can be more responsive. So we can be more connected. This is how we make the future of healthcare special. By making you experience you are special in every sense.
Hindi pa nag-i-start. Ang dami ng galit. Flattening the mental health. Flattening the patients daw.
We go beyond care. Experience MaxiCare today. MaxiCare Primary Care Clinic VGC is open to care for you 24 hours a day, every day. Visit other MaxiCare primary care centers at these locations.
Pag biglang nagkasakit, sagot ka ng e-Ready. Ang first prepaid emergency health card from MaxiCare. Sagot ang anumang sakit, sagot din ang sakit sa bulsa. Pag emergency, sagot ka ng MaxiCare e-Ready. Pag na-aksidente, sagot ka ng e-Ready, ang first prepaid emergency health card from MaxiCare. Sagot ang sakit ng katawan, sagot din ang sakit sa bulsa. Pag emergency, sagot ka ng MaxiCare e-Ready.
Hello. Please. This is me, Dr. Tolentino.
8 can bring you luck. Or change your luck.
This is Dr. Tolentino.
Fight the 8 deadly diseases. Dengue, malaria, pneumonia, and more.
Let's start.
With My MaxiCare Lite, the one-time prepaid health card for hospital confinement due to the 8 deadly diseases. So luck is always on your side. Fight the 8 with My MaxiCare Lite.
Let's start.
Si Mama, unlimited ang pagmamahal. Kaya unlimited din ang pasasalamat ko sa kanya. It's time to give back with MaxiCare Primo Gold, the affordable prepaid health card for senior citizens.
Kanina pa masama yung pakiramdam ko.
No comment daw. Loko dito.
Hello.
Start ba? Galit na yung mga ano.
Hello, good morning, everyone. I'm afraid we have been delayed. I'm not sure what the reason is. I've been online. I dialed in exactly before 10. However, there seems to be technical problems that has happened. And I know that this has caused, rather than flattening of the mental health curve, I think it has increased our tensions this morning. So let's start off with just a few minutes to deep breathe. Hopefully, this works. So let me start. I hope you are all safely at home or at work in this time of crisis, because as the wave of the new COVID-19 cases begin to crest, there is a second wave of health concerns which really require our attention and our timely response. So in today's webinar, I hope we get that sense of control and our can-do attitude that will help us as individuals first, because that's the way we will control this, and then as work teams, and finally as organizations, to be able to flatten the mental health curve. Next slide, please. So in my outline, I'd really like us to identify and understand how the different demographics has been responding to the pandemics, the quarantine, and also the new normal. We shall stratify this in understanding how the workforce is responding, how different demographics like women and those staying at working from home and the different generations, to give us a clear idea of we are all different, but we need to be one in being able to fight this, and focus on the mental health of workers, and finally look at how our response be as individuals, as work teams, and I'd like to focus on how managers and HR people are doing it. So next slide, please. We are all vulnerable to mental health problems. Let us review the studies on demographics in workplaces as to the effects of not just the pandemic, but also the quarantine and the new normal on workers. This is a US study, but we could already imagine what it is doing in a country like ours. In the weeks following the stay-at-home orders in the States and shutdown of commerce, as much as 88%, so practically every one of the US workers say they have been experiencing moderate to extreme stress based on a survey conducted by Ginger. Further, 69% of workers say that right now is the most stressful time of their entire careers, even more stressful than the September 11 terrorist attacks and the 2008 Great Recession. And as much as almost half, 43% of workers say they have become physically ill due to the work-related stress. 62%, over half, have reported losing at least an hour a day, and half of that, 32%, said they lost at least 2 hours per day because of COVID-related stress. Next slide, please. Now, looking at just women's mental health, and this is based on research by the Pew Research Team. Women, young people, and those with lower incomes, those whose jobs or income have been cut or they have been having less work, they are more likely than other groups to fall in the high distress category. Women of all ages are more likely than men to be in the high distress group. And this is seen in different other studies, okay? As much as 28% versus only 19% of men. However, even more particular than that, our millennial women and Gen Z women, 18 to 29 years old, 37% or a third are particularly likely to be classified as experiencing even higher levels of distress. So distress is higher than just stress. People who report difficulty dealing with childcare. So these are moms and dads during this time because of the school closing and work from home obligations, which actually has blurred all the different boundaries. About a third of those with young children may be experiencing high levels of psychological distress. Now, amongst those who have children under 12, so check around you, see if this is you in the home, or who say that child care responsibilities during the outbreak have been somewhat or very difficult. And 34%, a third, fall into the high distress group, a number that rises to as much as 42% when it comes to women. Next slide, please. Now, amongst women, amongst the generations, there are differences in the way we respond. So the baby boomers, I suppose I might be there. Those born between, ayan, revelation na yan. Those between 1946 to 64, I might be a little old, younger. And older may have greater set of experiences in the past. So their attention is likely going to be turned more to their grandchildren, to their children, than to their own health. However, and this we have seen, the younger generations just stare down on problems, which is a coping or their own survival mechanism. They don't problemize it too much. For example, and we just saw this, and this is already happening in Florida. After the spring break was announced, everyone went to bars, to the beaches, etc., as if there was no pandemic going on. Studies suggest that millennials are actually more stressed than other generations, which is actually why they're often referred to as the worry generation. A 2018 survey from the American Psychological Association found that Gen Z adults, even the young adults right now who are just coming into the workforce, are most likely of all generations to report poor mental health. Next slide, please. What are, based on studies, and I like to use evidence para meron namang basis and weight yung ating pinag-uusapan. What are considered, based on studies, the main stressors during the pandemic, this and other pandemics? First, obviously, is the perception of safety, of threat, and the high risk of the contagion. This happens before the pandemic when it's announced, during the quarantine when we are all scared and we'd rather stay out, and when it comes to the new normal. Second is the infobesity and the unknown. There's just so much news out there from official sources as well as social media. And it is so much that we have to thresh out which ones to even put attention to. And part of the control is which one we should pass on, or if we should at all. Then third is, that should be quarantine and confinement. In all the different pandemics, including COVID-19, there have been a lot of studies on how long quarantine should be and what are the mental health consequences of both quarantine and confinement. And on different age groups, it has its particular effects, and we'll talk about that. Of course, there's a lot of stigma and social exclusion going on. And this is important to talk about because this is going to be one of the preventives. If people feel stigmatized to even consult or recognize their problem as a mental health problem, we will not be able to flatten the curve. We need to now be more accepting of individuals who might be reacting to this particular pandemic. And of course, there's a lot of financial loss and job insecurity going on around. And in past crises in the United States, etc., this actually translated to increases in both suicide as well as self-harm. So these are the things we really need to anticipate in terms of what is going on. So different people, different folks, different strokes. Next slide, please. And when it comes to how we react to pandemic, we may all be different based on a subset of things that are either built in, based on our experiences, and based on how we have coped in past crises. So the patterns of psychological reactions to pandemics are really quite complex. Even genetics can be involved. Whereas some people are highly resilient to stress because of their personal makeup, the way they were brought up, their genetics, etc. Other individuals become highly distressed when confronted with very threatening events, including this kind of pandemic. Thus, the way people react is also varied. Whether it is just threatened, so it's just in their minds, or an actual pandemic. Some react with indifference or resignation. These are called the blunters as their way of coping. They blunt out or flatten what they find is too threatening or scary. So deadma sila. And there are others who become highly fearful or anxious, and some even develop emotional disorders such as the post-traumatic stress disorder, or if it's not a disorder, they develop psychological trauma. And some people, in fact, a lot of us will recover from these emotional problems once the pandemic threat passes, or we've been going through ups and downs, like up when they announced the pandemic is international. Then we adjusted. And then very soon after, boom, because of the quarantine that was going extension, 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 then we had a new set of coping that we, or adjustments that we had to go through. Then we adjusted, most of us. And then the new normal, are we going back to work, etc. Another set of adjustments happening. But as I said, for the most part, when it passes, we adapt. However, there are some people, and we will mention those who might be at particular risk because they will have enduring emotional reactions. So let me just ask you and think about this. How have you been reacting to both the COVID-19, to the ECQ, and now to the announced new normal? Let's look at different coping mechanisms. Next slide, please. So people may react either emotionally, physically, behaviorally, cognitively in terms of thinking, or sometimes even what we call spiritually. When they start questioning their values, tama pa ba to? Should I quit work altogether, etc. And these are some of those reactions that I have from different organizations picked up. Obviously, fear of dying from the virus, the fear of infection. At the beginning, frustration over lack of supplies, and this is not only for healthcare workers, but even for housewives when they go out to the groceries. The anger over the underpreparedness. But truth is, no one was adequately prepared for this. Missing family and friends whom we could not just casually socialize with, and that includes our workmates. Feeling exhausted or fatigued, even though we are just at home. We don't confront traffic, but we are confronting other issues which tire us out. And the cognitive reaction, constantly having racing thoughts, or the opposite. When you are working from home, having difficulty in concentrating because it is not an ideal situation. And of course, coming into the new normal, the apprehension about going to public spaces, not being touched, when somebody coughs, suddenly you have to run. Physical reaction includes either insomnia, can't get sleep, can't maintain sleep, or waking too early and can't go back to sleep, or the opposite. And this is among young people, for example, these days, rather than doing anything, they sleep off the whole day. And then there's, of course, a lot of physical and emotional stress or trouble relaxing. Some have resorted to substance use, increase in the use of alcohol or sleeping pills or coffee, cigarettes or vaping, or food, which is the most easily accessible. So stress eating, feeling lonely and isolated is an emotional reaction. Feeling bored, depression and anxiety, which I'd like to focus on because, for one thing, it can be normal, especially at this point, but I will discuss later on when it becomes not normal or a disorder. And if you're feeling, increased heart rate more than usual, stomach upset that sometimes you get scared, am I already infected, fatigue, or other uncomfortable sensations, what I'd like to say is these are universal, common, and normal adjustment issues during a very abnormal situation such as this pandemic that we are experiencing, plus all the other consequent effects of the pandemic. Now, next slide, please. And this is important, especially in workplaces, to be able to flatten the curve. We should know when we should consider seeking further help. So if the stress persists for longer than 2 or 3 weeks, we're very strict in psychiatry because we do not want to pathologize everything. So if it's already persistent, 2, if it's getting more, the symptoms are getting more excessive and already causes distress, to the point that 3, it interferes with functionality on a personal level, social level, and occupational level, then one should consider seeking for a formal mental health referral. Now, next slide, please. Because the most common of the mental illnesses that may happen, based on studies also during the pandemic, would be depression and anxiety. I would like to highlight the symptoms of major depression just so that we could check on ourselves. So in psychiatry, we need at least 5 out of the 9 symptoms that you could see there. Okay, so either depressed mood or lack of interest in enjoyable activities. These are the cardinal symptoms. And then, of course, increase or decrease in appetite, most likely decrease. Insomnia or hypersomnia, not being able to sleep or sleeping too much, most likely not being able to sleep. Slowing of movement, or the opposite also. It could be you're too agitated because of not feeling okay, the lack of energy, sometimes the feeling of guilt or worthlessness. I'm not doing anything, I'm not good enough, etc. And the cognitive symptom is trouble concentrating, forgetting things, and all that. And of course, the most important, why we need to detect the possibility of depression, would be suicidality, thoughts, or even behaviors. Now, if you have 5 of those symptoms over, again, a 2-week period and causing impairment, again, in social, occupational, and other important areas of functioning, even personal, then that will be considered a major depressive disorder, not just depression as a normal emotion. The other, next slide, please, consideration is that for anxiety. Again, when does it become a disorder? When there's excessive worry, restlessness, being easily fatigued, trouble concentrating, that's shared with depression, irritability, especially for children. Young people, young kids, do not know how to express what they're feeling, so they show it in terms of behavior. So irritability could be shown by children, amongst other things. And then, of course, again, sleep disturbance that we have mentioned, and a lot of muscle tension. So this is usually over a longer period of time, and it should also connect with impairment in functionality. Now, if you pick up that you may have most of these symptoms, next slide, please, we need you to actually call. So the moment you feel the need, or when previous attempts, because we tried to cope first on our own, but if the problem has not been successful, that might be one indication to call. When the problem becomes your only focus, practically you are not able to attend to your personal, social, or work functions, it might be time to call. And when the situation is negatively affecting your important relationships because you are either withdrawn or refuse to seek help, and when the situation is already negatively affecting your functionality or role performance as a mom, as a dad, as a coworker, as a manager, it might be time to call. And when we talk about calling, let me just share with you different organizations. Next slide, please. Have different programs. I'm sharing this because it is close to home. I work in Makati Med. So on the left would be, on both, is our Bayanihan at Makati Med. We actually offer help to any of our healthcare workers, including our consultants, the service, the security, elevator personnel. We give free psychosocial programs. And next slide, please. In another government hospital that I'm connected with, on the right would be Ligtas na Kanlungan. This actually literally translates into safe haven. This on the right is for any patients outside of QMMC, Memorial Medical Center. On the left is actually a poster for all employees, from doctors all the way to any employee at Quirino Memorial Medical Center. But for you out there, next slide, please. There are available mental health resources, and we encourage, if we are to flatten the mental health curve, if you pick up that the symptoms are excessive, you have so many resources on top of what you may have in your respective companies. Next slide, please. So let's get down and tackle business. How do we flatten the mental health curve? Now, as we talk about this, I would like to put emphasis that, like the announcement when you ride the plane, first thing they do is to tell you that in the event of an emergency, you should don on your oxygen mask before helping others. So in the same light, we will be able to flatten the curve, but that work starts with us as individuals, and then our work teams, and then our organizations, so that we could all heal as one. So let me just start off stating, next slide, please, because I want to put things in to perspective. Now, one of the most profound changes that has been happening on account of COVID-19 has been how the social contract, and I'll go into the examples for us to be able to understand this, has completely changed in a matter of, overnight, okay? Particularly between employers and employees. And an implicit contract, we don't state it out, is based on something already accepted, and generally it's unspoken. These are assumptions of the way things should be or the way things are. Like the following. So consider all these changing in our social contract. There used to be an accepted boundary between work life, you go to work physically, and home life. This has totally dissolved. Okay, for millions of coworkers, we now do life together somewhat. If like this, you could practically see what's going on inside my room, etc. I could see if your video was on, what you look like on a day wherein you're just at home also working. So we blur the boundaries. Of course, this time around, the emotional well-being of the workforce has become a greater and much more visible priority, I hope, in all the different organizations. And I know this because I've been doing webinars requested by different companies to actually help, particularly in the mental health of people in the workplaces. There's a lot of trauma on account of either job losses or personal accounts of witnessing people who have gone sick or family members or any other loss. There are the biases we used to have. Tamad ka if you're working from home. They are dissolving. In fact, you are doing a great job by staying home. So even government agencies are the ones pushing for us to just stay home because that is our contribution. Businesses and governments have experienced the downside of job fluidity, wrestling on how to support irregular workers or contractual workers, especially at this point when a lot of them are being laid off, who now make up a large portion of the workforce. And further, there has been the emphasis and expectations, both from our side, the employees, and from the side of management, for the safety of everyone. So the physical, emotional, financial, as well as digital safety is important. And this has profoundly increased across all the stakeholder groups, but especially amongst employees. Next slide, please. So how do we, what are, and this is based on a big study, a meta-analysis. They looked into what may moderate. Moderating means either it will lessen or mitigate or aggravate all the effects of COVID on employees' health. And as I've been following, it could be from individual factors, and we mentioned there are being a woman, having or being elderly, or being a mom, etc., may be factors that may aggravate. It may be more difficult on you. From the organizational factors, depending on the role, occupational role, on what the organization has done in terms of safety, and how much emphasis they have given on health management, and how much training, for example, they have given people with regards teleworking and the equipments. Ayan na, lumalabas yung teleworking equipments that we have had a problem on at the start of this. And when we talk of institutional factors, these are factors which are based on what the government tells us and the rules, etc., in terms of all these quarantine, physical distancing, etc. So let's begin. What are those? Next slide, please. Individual factors. So I'd like now for us to be practical as to how do we take care of ourselves? What are these individual factors? Next slide, please. So first and foremost, as I mentioned earlier, we need first to take care of ourselves. And taking care of our mental health means, first and foremost, feel free to feel your feelings. Do you know how you're feeling at this point? Or when you hear the news in the afternoon about, surges in COVID-19. Be there. Try to feel your feelings. Be aware of how you are feeling, because that's the way we could do something about it. Second is intentionally or deliberately employ coping strategies. How? We have been through a lot of crises. Maybe not like this one, but we could start off on the coping strategies that helped us during past crises. And even when we help other people, that is our starting point. And throughout the day, and when there are different circumstances, perform regular check-ins with yourself. How am I doing? How am I solving this? What is the best thing that I could do? Please, number 4, very important, take breaks from the news and the social media. And finally, be fortified, remembering that there are important meanings to what is happening in our lives, not just work, but beyond work. Next slide, please. I would like us to focus on this concept, and this is internalizing our controls. And I'm using the circle to visualize this. Internally, I could only control how I respond to others, whether I decide to follow the rules, which I obviously would suggest, and if I have information, what of those information I even pass on social media, etc. These are things that I can control. Outside of that, if somebody loses a job, I will be sorry, but it's not, I cannot be able to put control on that. Whether somebody develops COVID, I could empathize, but I will choose that not to let it affect me, how others act, or how the government responds. So in this crisis, when there's just so much happening, it's not bad to be selfish and put control more of internally on our inner circle. Next slide, please. And just as a tip, to manage the psychological stress that is all over us, very important to remember the acronym CRUMS. C stands for connections. Let's reach out to friends and family for support. We can't do this alone. And as much as you do help or you want to help others, be also able to accept help when that is needed. And that is part of being able to staying in control. I can give, but I could also accept help when that is necessary. R, very important, is creating routine. And this actually, you know what happened as soon as there was the quarantine, there was practically everything bogged down. We're not able to go out, you could just sleep the whole day. And the main thing about it is that feeling that we lost control. And part of gaining back that control is putting back structures, putting a schedule, sleeping at the same time and waking up the same time, and filling out that day. This would be taking care of the kids, working, having my lunch without any work, etc., back to work, leisure, etc., and down the line. And that will help us. And I will not use the word work-life balance because balance is a little challenging at this point. I would rather suggest work-life harmony. Let's harmonize what's going on based on what we can control. And that starts off with routine. U is for understanding, and that means realizing that there's a lot of uncertainty and disruptions in our life, and accepting that. Okay, being able to see this pandemic more as a marathon rather than a sprint. So we need to pace ourselves. There's nothing that is pushing us to hurry up. Take it day at a time, which leads us to M, which is mindfulness. And the principle of mindfulness is really living and staying in your here and now. Not even an hour from now. Tsaka na natin pag-usapan yung lunch natin, okay? Savor your moments, okay? Because here, this is something that is totally within our control. The past is gone. There's nothing we could do about that. Even the future is something that we don't have. Not even the most brilliant scientists would know what the future holds, not even the richest governments. And boundaries for B. We need to set limitations, those boundaries to manage and it could be just in terms of information and social media, even our worries. If we're too worried all the time, let's put a boundary. I will give myself, from 5 p.m. to 5:15 p.m. all the time to worry, and then I move on to other things. Or that's the only time I will use to listen to the news only from DOH or WHO or the IATF and nothing more. And of course, at the end of the day, S, self-care. And that includes physical, emotional, and spiritual self-care. Next slide, please. Now, how do we take care of our work team? Very important too. Next slide, please. So this is coming from the American Medical Association. So we need to help adjust staffing procedures and even schedules when necessary because these are unusual times. We cannot follow what we used to do if we were in the office. And within, of course, this has to be within applicable legal limits and only when possible. Even rotate workers from those coming from higher stress to lower stress functions. We try to do this even in our hospitals. Then, very important to normalize talking about psychosocial and having psychosocial support. I think if you are enrolled to MaxiCare, they do provide enrollees with psychosocial or mental health support. Monitor and review staff member well-being. If you are the head, you know your people because you are constantly in touch with them. Already red flag those whom you know might be in a particularly difficult circumstance, and constantly create an environment of open communication. They will only ask for help if they know that you are open to this kind of conversations. Next slide, please. We need also, next slide, please, to intentionally check in, meaning deliberately check in with each other, do a one-on-one, find the opportunity to check in within the work week. This coming Friday before the weekend, let me check in on somebody I know who might be a little alone or isolated. And then let's leverage technology. There's Newman, there's Coffee, there's actually also, of course, the more serious virtual working sessions. Be intentional about even the questions that you ask. Tama na yung, how are you? Let's be a little more focused. How are you in there alone in the condo? Is there anyone you're talking to, etc., etc.? Is there anything I could do for you? Be mindful also of privacy policies. If they reveal something to you that has to do with mental health issues or something secret, respect that. Okay. And if you think it is already affecting them, that's when you suggest, would you want to talk to somebody else? So just as an example, in a company in the States, Qualtrics, they created a remote work pulse to gauge how employees' well-being is happening on a daily or even weekly basis. Next, please. Then we have to be, next slide, very proactive. Tayo na ang mag-a-action if we are to flatten the mental health curve, and be transparent in the communications. So very important ang communications at this point. Keep employees up to date. COVID-19 related updates from credible sources. In my hospital in Makati Med, the medical center chief, our director, actually gives out a bulletin, one pager, that tells us exactly what's happening, where we are, okay, and what we need to do. Every big conference, there will be an infectious person who's the specialist who will explain to us anything that is latest, because this is developing very, very rapidly. Work-related changes, if there are any, and shifting client demands, how the team is being distributed, perhaps also explaining why this may be necessary, and if there are new policies, because as I said, things are changing very rapidly. And then, of course, reassurance constantly, if that could be given about job security, because this is something that people depend on. And then clarify work hours, the flows, the communication norms, but very important to be quite flexible when it comes to this. It helps to stop exchanging emails or work-related things after 6 p.m. or whatever it is that you decide upon as a group. There are apps that they use in the States. If there's a quick question, they will just say, okay, let's Viber, but you don't have to answer, just a thought for tomorrow, for example. Encourage flexible working hours to allow employees to work in a way that kind of helps and best fits their mental health needs. So hours and breaks. So as long as they do the X number of hours, and if they need time, because as we have been offering teleconsults, allow them, for example, for time for their therapy. Next slide, please. Now, a particular group, and I wanted to discuss this because in other companies, this has been a major challenge, and we need to understand these challenges from working from home. Next, please. So when we're working from home, let's remember to be on top of things, because things can just be totally a mess, and we don't have any boundaries anymore. So very important to schedule some unscheduled time with your colleagues. Set a time when, for example, first thing in the morning, to just settle yourself. Let's just talk, etc., while having the breakfast or coffee. That could be done. Very important, and I always emphasize the next. Define or separate your workspace. I am in a little corner in my study. I use, headset so that I do not get distracted. And every time I sit in this spot, I know that I am going to do some work. So that already cues our body, the same as what I advise. Don't do any work or watching television or doing other stuff on your bed, so that your body is also conditioned that once it lies down, it's just going to sleep. We are all conditioned in the kitchen. We stay there 10, 15 minutes, and then you're reaching out for a drink or food. Let's do that for our workspaces at home. And within the day, as I mentioned this already, let us put structures or separate time for work, for your kids, etc. It also helps, and to connect this with the workspace, other people at home know that if I'm seated in my workspace, if it's like an open condo, that you are working and that you are not to be disturbed. So it helps very much. And constantly take a digital break. Stand up. Uh, Less sitting, the better. Okay. So if you need to do other kinds of things, get away from the desk and do it elsewhere. Next slide, please. Now, what can leaders and organizations do? What are the mental health initiatives that we can suggest to flatten the curve? Next slide, please. It's very important, and this is based on studies, okay? From a human resource management perspective, to lessen the outcomes, we need to optimize communication and transparency. So whatever is happening in the organization that changes, especially as we move back to the workplaces, we need to be able to talk about that. Transparency when it comes to new policies, to changes in organization. There will be changes even in the physical way that we will be received back in the offices. That has to be announced way in advance. We need to prevent stigma. Okay, at every point when we see stigma, it should be addressed. This also is particular with regards mental health, so that in fact people can reach out and ask for help. The earlier the better. And studies upon studies show that if we intervene much earlier, then the consequences are actually attenuated or lessened. And training has been seen time and again to be a protective factor, especially at this point in time. People do not know how they should actually approach, for example, customers in this new time. What are the not to do's and what are the to do's? So, very important before bringing them, starting off with managers, let us come up with training programs to make people understand what changes have happened. And of course, we have shifted to teleworking. Uh, this could be used not just for work, but to prevent the social isolation. I understand because of my dealings with other companies that some individuals actually, as soon as they announced lockdown, were either in a place that was not their own either province or locale, and they were actually alone in a condo, etc. We need to understand this and make sure that we lessen that feeling of social isolation, leveraging on the use of technology. And at a time like this, we need to support our people, not just at the workplace, but also socially. Let's move to some of the more practical steps. Next slide, please. So for managers and HR professionals, this is the time to show empathy and be available because people are suffering, both economically, emotionally, their mental health is affected. Let us be there for them. But for that to happen, we need also to be whole. Buo tayo to be able to help others. Stay connected, okay? Check in with employees at least once a week or even more often to provide support as well as coaching. Recognize the impact of isolation. We already mentioned that, and loneliness. This has caused, for example, a few of our OFWs have been victims of suicide in other locales because of this feeling of isolation and hopelessness. So let's be there for them. Encourage employees to also share stories of how they are coping. This helps actually increase the possibilities of, oh, I could do that as well, you know, when other colleagues hear about those. Infuse appropriate humor, okay, into conversation. We are all about humor, especially amongst us Pinoys. Encourage online training to sharpen and or develop new skills for your employees. And it could be directly related to work or something that could actually further improve their skills. Check in if you have an employee assistance program or an HMO to confirm the availability of mental health services. Know whom to contact so that if somebody needs, you could just connect before telling your employee to go check with this individual. Be also in the know of how you will access the different resources your company has. Next slide, please. All together, what can we all do? Let's be realistic. We can be vulnerable, but also model healthy behaviors, but this especially for leaders. So let's be all honest about the challenges we are experiencing personally. That's the only way we could let it out of our system, only if you're ready to talk about it. If not, at least to the person that you trust most. Share how you are managing your own mental health issues. to be able to normalize. It is normal that I'm experiencing, some sadness sometimes, some boredom, some anxiety, and also normalize self-care. This is what I do about it. And also that there is a need to set boundaries. For leaders, this means do not, as much as possible, call after 6 p.m. or after agreed office hours. Wait it out until the next day, especially if it is not an emergency. Practice and commit to healthy working norms so that you could model healthy behavior, and even normalize the challenges that come with virtual working, because it is difficult and it has challenges of its own. And continue communicating that it will take time to adjust for everyone. The older members of the team might have more difficulty in learning technology, for example. As an example of this, one of the CEOs actually had a virtual town hall meeting from the laundry room, because that was where his internet was strongest, and it was just showing vulnerability and also normalizing that this could be difficult actually, even in terms of technology, even for a CEO. Next slide, please. Now, for all of us, we need to, especially leaders, respond supportively, particularly to those who were red flagged employees who may be struggling. So in some companies, we have actually introduced a very simple tool, psychological first aid, where we just teach them to look out for those who may be vulnerable, to listen actively, and then if needed, to link to whatever services we have. So some of these principles are in the recommendation. So be present and listen actively. We don't need to use any diagnosis, even in PFA, that's not for diagnosis, or assume what they need. Just listening actively might be enough in certain circumstances. Reassure them that what they're experiencing is, for the most part, normal, as we have talked about earlier. And also give affirmations. That's important in terms of what they contribute to the work. Accept the process. I want to make sure I can support you. Is it okay if I check in on you? Either this or what? Think about what you have coped with in the past, and we could talk about some of those solutions that you have thought about. In cases where employees disclose a mental health condition to you as manager, tell employee if it's okay to inform HR, so that you could be linked, which is the third part in PFA, linking to the resources, whether it's your HMO, your HR, or your company resource. If there's a psychiatrist that the company resources has, they can be reached out only if the employee actually allows for that. Express, of course, our gratitude and appreciation for revealing and trusting you with the information. Next slide, please. And for all of us, for things to happen and for people to seek help, let us eliminate the stigma of mental health. Acknowledge the impact of the situation on mental health. For all of us, this is a crisis. It is an abnormal situation, but a lot of our reactions are universal and normal. And make it clear that mental health is something that your company cares about and even prioritizes. Acknowledge all employees' mental health experiences, from just being stressed out to being distressed, or even to those who reveal that they have a disorder. In addition to words like stress, wellness, mindfulness, Be deliberate or intentional about naming also, as we have been doing in this talk, depression, anxiety, even psychological trauma, which can occur on account of what has hit us in the past couple of months. Next slide, please. So now, I think this is my last main slide. How do we plan out for the return to the workplace? So for this to happen, we need now to define and determine which functions, which work, which roles need to return on the workplace to be effective in the near term, ASAP, and which continue to be needed or can be worked through remotely. Use rigor in determining those essential to work physically in the workplace, because that would mean exposing them to possible infections, okay? As this enables also more effective application of the general safety measures that we are all doing. Assess the type of work teams that may need to be in person, doing in person work, including how long, if they need to stay, as an input to space planning and safety design to make sure there is physical distancing even within the workplace. And it might be a little more uncomfortable these days, especially if your office has a window. It's important that it's kept open. Provide support to teams who work remotely. Let's not forget about them. Define the practices and policies for remote teams, considering the factors such as different working styles, different norms, and enabling technology. And deliver training to make sure that they are aware of how to do this, where to situate their workspaces, and how, in general, to work remotely in a very effective way. Now, most scenarios that evaluate potential workforce and workplace options with a lens to productivity, the cost, of course, the safety, which is imperative, and also uh, operating conditions that has to happen. And then we could develop staggered plan to get the targeted people back into the workplace. Others do, 30%, then the next 30%, etc. And then develop and model guidelines for testing, which is already imperative at this point, monitoring, space and facilities management, from entry, how guests should be accepted all the way into the particular workspaces, and visitor management geared towards productivity, mental, as well as psychological safety. So with that, let me just conclude. Next slide, please. So a clarion call for courageous action beckons all of us. How do we answer? How do we find that grit, that bravery, that tapang to continue despite our fears, to be our best selves, and to get ourselves through this predicament and what we're all in together? What story will be told of these challenging days? Let us all meet this challenge with clean hands, sharp minds, clear eyes, and open hearts. Maraming salamat po. Shine?
Hi, Dr. Tolentino. Thank you so much for that very extensive and informative lecture. Um, we really definitely learned a lot about mental health in the workplace. But before we even go to the questions, I'd like to take this opportunity to formally introduce you to everyone here today. So, Dr. Tolentino, as you know, is a premier mental health practitioner in our country. He has pursued training in drug and alcohol studies in the US. He's an active member of the Technical Working Group for the Philippine Mental Health Act and into the strategic plan of the Philippine Council for Mental Health. He's not only the past president of our Philippine Psychiatric Association, he's also the current chair of the Department of Psychiatry at Quirino Memorial Medical Center and the former chief of the section of psychiatry at Makati Medical Center. He has represented our country in the field of psychiatry in international conventions and summits, and most of his work really centers on protecting workplace mental health. So thank you so much, Dr. Tolentino.
Thank you, Shine.
It really helps to know. Yes.
I
It really
really
does
would
help.
like to apologize for the delay. We could have had more discussions, and
I know.
yeah, so very sorry about that. I was ready, however,
Yeah.
as we mentioned, technical difficulties sometimes challenge us in these days.
That's true. Yes, we do apologize for that, but at least we still have some time to answer some questions. If that's okay with you, sir.
Certainly.
Let's start with one question. Do you have any suggestions to the government on how to flatten the curve and not fatten the curve, or at least your view on this aspect?
I would rather stay within my area of expertise. The truth is, as you could see, even the United States, rich as it is, hasn't even solved the issue. Some countries, after rich countries at that, highly developed, highly resourced countries, have had their own struggles. Italy, Spain, and all that. So we are just right there. I think for the most part, again, rather than and the reality is, like the government or don't like the government, there's nothing much we could do. But there are lots of things we could do on a personal level, or at most on within our sphere of influence. And let's do that, because the more we get frustrated, uh, feeling that no, is there anyone in charge? Hello, the more we just put our own mental health down, because those are totally out of our control, unfortunately. I emphasize that in the scheme of flattening, not flattening the curve. Thank you for a new lesson. We really need to start off with ourselves. So even in the presentation, you saw that I emphasized first individual factors before we could move on to institutional factors. So let's do our share. We will heal as one, but it always will start with us.
All right, thanks so much, Doctor. Now, our next question is, how do you start to be more accepting as to not contribute to the distress of others, especially if you don't have any experience of what they're going through or their circumstances?
Thank you for that. Truth to tell, we all have no experience in this. I don't think there's anyone in the audience right now who experienced World War II. I refer to that because that would have been the last, world kind of, crisis that has happened to everyone. We don't have any experience, and therefore we really need to. Again, I'm back to starting with ourselves, and to be more specific, for us to even be able to start anywhere, we need to get in touch. And my very first statement with regards helping is being in touch with your feeling. We feel like, remember, all of the things that has happened to us made us lose that sense of control. It's as if one day we were working March 13, we were still at work. Yes, there was a lot of news, blah, blah, blah. Yes, we started wearing masks, or some of us. And then the next day, there was the first case. And then in 3 days, we were on quarantine. Who would prepare for that, I I wasn't able to bring any patient's charts, not even prescriptions at home. And I've been staying working from home. So we need just to put a certain sense of control back. And it starts with, how am I feeling? Because this I could control. Other things I can't. Okay. So those are important, that sense of feeling, putting structure where we can in our day to day. What time am I waking up? What do I do after? You know, put a certain sense of routine. Focus on other things. The more we hear about, you know, all these cases, blah, 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 the more we feel hopeless and helpless. But that is not up to us. There are a lot more things that we can. If I could share with you, I'm learning Spanish and French. Morning Spanish, evening French, 15 minutes, you know. So I have these capsules within the day. I will work, I will break, I do my 15-minute thing. I wanted a certification for my psychological first aid. Every so many days, I will turn on my course, blah, blah, blah. Now I have a certification, and on to my next, etc. These are things well within our control. Ika nga nila, if at the end of the quarantine, the pandemic, etc., you did not learn any new thing, any new skills, any new hassle, you didn't have any new hassle, like, you know, selling food, etc., etc. It was not for lack of time. It was for lack of any initiative. So let's do that, because these are the things we can control. And by the way, once you're able to do things, what I always share with my patients, do not forget, affirm yourself. This is actually letting you know, I did something, I was successful, and I'm good. If I did this, I'm going to do it next time. Mark the lessons, because if this is the worst so far that we have experienced in terms of life events, it can actually be an impetus for growth. There's such a thing even called traumatic growth. Even if people have gone through the worst trauma in their lives, those who are resilient, those who learn the lessons, actually even grow as a result of that. So those lessons, start with yourself, okay? Put control where you can. Very important, learn the lessons, okay, so that we could grow, because you could use this as your template in case you find, knock on wood, we don't have any further crisis, but that's part of life, you know. And after we succeed in whatever endeavors we try out now, go give yourself a pat in the back, an affirmation.
We just really need to find ways to grow during this
We do.
difficult times. Yes. Okay, thanks, sir. So another question is a bit more specific for this person. It's what should I say to my employer if I'm encountering anxiety because of a tight deadline? Example, working beyond 8 hours because of their deadlines, and it's not necessarily my fault. Any
It's
suggestions?
very interesting, because in fact, a certain company, right off the bat, they were so aware that mental health would be needed. So they immediately asked for telemental health services for their employees. And I heard this time and again. Very important. What I do encourage is that, as I mentioned already, people are not aware that this is all totally sudden, totally new, etc., etc. That there are specific challenges also, despite them working from home. You know, teleworking. You are not your optimal best, and it is indeed important to also give your employer, your boss, etc., feedback. See, this is the thing that I emphasize also amongst work teams, communication, and we need to be able to open with this communication. Now, let me tell you also that since I was introduced with regards to the Mental Health Act, there is in fact a department order by the DOLE for private companies to have a workplace mental health policy and program. So in that, that will not be, if you are encountering any mental health issue, that should not be a reason for them to either demote, remove you from work, etc., etc. So there are protections for individuals who may be suffering from some mental health issues. We need to see mental health issues as similar to physical health. I will not be removed just because I had hypertension. I will not be removed just because I have been diagnosed for diabetes, etc. So very clear, if you have even depression, etc., these are highly treatable conditions. In fact, ang dami-daming gamot for depression, for anxiety, etc., which are not addictive, by the way. So important that, number one, have that communication, have that talk, okay? Two, as I mentioned, and I constantly say this, it is imperative that workplaces have at least, you don't have to have it in the company, but it could be external resources to connect employees to help when they are needed. And if worse comes to worse, as I mentioned and I flashed, there are free mental health resources as well happening as we speak. So that is available online. That's why I didn't have to flash it too long. Do also seek out help for yourself. In the scheme of things, help is like a pyramid. We start off on the base of the pyramid with self-help and self-care. As much as possible, we need, especially at a time that's so difficult like this, constantly check in on yourself and do self-care. If it's not working, as I mentioned earlier, and you need to talk to someone, elevate. Talk to your manager. Some companies, by the way, have already some training, at least on psychological first aid. So HR and managers are being trained how to do the talk. And if needed, and they pick up something beyond them, then you could go into the top of the pyramid, which is the mental health resources, if it's available, or if not, and then outside the company, it could still be available. I hope that I was able to elaborate the steps, the practical steps that we could take.
I think you were able to expound on that further, Dr. Tolentino.
Thank you.
Are you okay to still answer some more questions? We have a couple here.
Sure.
Okay. So someone is asking, how can we effectively convince a loved one to seek professional help if he or she is in denial? We have a couple of other questions related to this. Like, for example, they already know that there are physical symptoms observed, but still they're saying it's okay and they're fine. Do you have any suggestions?
Number one, as I've been saying, this is really difficult because we have stigmatized mental health for such a long time. However, note that mental health issues, that's why the way I presented our reactions were physical, emotional, sometimes it may manifest behaviorally, or cognitively, not being able to think, or thinking and thinking, too much. And fifth is even spiritually, when they start questioning values, I need to quit work, I don't like this anymore, etc., etc. Different ways of presenting with a possible mental health issue. And sometimes the handle might be, for most people, would be the physical because it is so concrete. Nakikita, nararamdaman. And you could start off with that. You say you have not been sleeping the last few days, and then the next day you feel really tired, you're not able to think to do work, etc., etc. Would you like to us to find somebody if it's your partner? Okay, so very important is to already be prepared also with the resources. Be honest also. There are certain things, which I may not be able to help you with, but somebody who might be in the know might be able to help you. Let's check. Might your company have, if it's work within the workplace, or would you like to talk to somebody? I saw from Dr. Tolentino's talk, free mental health resources, call-ins, just to find out, so find out listen attentively and find out what might be the hook that you might be able to use to encourage and connect the individual or link that individual to resources that you should be ready in case mag-yes. What I'll do is I shall try to connect if you're aware of the workplace resource, then I will connect and see when you could talk to somebody, or if you have found already a free call in, okay, do so as well. So I hope that's more practical, okay, para lang hanap tayo ng hook, whatever it is, okay. Be honest, be there to support that individual. Work through it kung kaya muna, kung gusto muna niya, what would you want to do? What have you tried doing? So looking at the coping mechanisms. What has worked before? Okay, what is still not working? And it's really beyond. Would you like me to link to a resource?
Okay. All right. I believe we have some more questions, but I actually think we have only time for one last one. This is coming from an anonymous attendee. What is
Sure.
your advice for HR professionals who are also distressed at this time and might not feel capable to support other employees? So it's the helper needing help.
Okay, very important. I will always emphasize, start with yourself, okay? And if you find that you are not able to, that is also okay. Start with helping yourself first. Be honest. If you need to seek help yourself, we cannot. Even us psychiatrists, if we are not prepared, we don't. At the beginning, we had to shift to telepsychiatry and learn within a week or two. Lucky me that in my hospital, we were given all the resources, all the help, to immediately move to that. But that wasn't taught in med school. So same, we go through your own process yourself. How am I feeling? If you're not ready to help anyone, first help yourself. Okay, and then if needed, same steps as we mentioned earlier. Look out for what the resources are. Unfortunately, and this is the reality because I'm connected with several companies, people would rather access external resources, and that's okay too. As a company psychiatrist for Philippine Airlines, what I do is, if they do that, my help is, let me translate that psychiatrist prescription into our PAL prescription so you get your medications free. But I encourage, I don't have to be the one, okay? And in the same way, if there are things that I will not be able to handle, for example, if they present little child cases and that's not my specialty, I also tell them, you know what, I'd really like to help you, but that's not my line. Let me connect you with a colleague of mine. So self-knowledge, okay, self-feeling, understand yourself, accepting yourself also if you're not ready to help others, and then seek help if you need it.
Yes, that's right. It's really to know where we are at the present moment and learn how
Moment.
to better take care of ourselves, right? And realize that we can actually work with our colleagues and the people in our environment so we can build stronger connections. And so, okay. Thank you so much, Dr. Tolentino, for
My
that very
pleasure.
informative presentation. And for now, I'd like to turn you over to Dr. Art Libao. He's the Deputy Medical Director of MaxiCare, and he would like to say a few words. Hi, Doc Art. Okay, so while we're waiting for Dr. Art, I believe there were some questions about MaxiCare covering consultations with psychiatry doctors. Actually, MaxiCare, if you're a member of MaxiCare, you can go to the primary care centers in BGC and in Bridgetown, and we do have psychiatrists who are there to help you out. And it is covered by your insurance plan, so that's for free. If it's outside of MaxiCare, if it's outside the primary care centers, then that may be that's not yet included. That's different. It depends on your coverage. Okay, so Dr. Art, are you
Wala
ready?
pa rin. Ayan, yeah.
There,
Okay.
I can hear you.
Okay.
Okay.
And
Hi, Dr.
okay,
Art.
yeah, Shine. Good morning, everyone. Before I give a short reaction and share my closing remarks, delayed as it is, no, please allow me to share a few information regarding our facilitator, Doctor today, Dr. Shiny Monar. She is an alumna of the University of the East Ramon Magsaysay Memorial Medical Center, and she took her residency and fellowship training in addiction psychiatry in the medical city. And currently, she is a consultant at the Medical City and Victor R. Potenciano Medical Center. Now, in reaction to what our speaker said, no, Ed and the speaker and I go a long way back medical school and in residency training. And as a take-home lesson, I'd like to emphasize on what Ed meant regarding the if you do not learn anything during the ECQ, it's not because of a lack of a talent, but lack of an initiative. No, and I remember I never realized that ECQ can bring out the artistic part of me. No, because I never realized that I can draw, and I never realized that I can do gardening. No, but the ECQ taught me to garden and to take art classes. No, and second, this is really bad times. The COVID-19 really brought bad times. And when I say bad times, the B means burnout, A for anxiety, and D for depression. No? And I guess everyone is really having a very bad time during this pandemic. Now, for my closing remarks, we apologize for the delay brought about by the technical glitch. We understand how the delay affected all of us negatively. No, we hope that the fried chicken and the gravy went well. We hope that the boss didn't reprimand you for coming in late. Now, seriously, we promise to evaluate what went wrong so that the problem will not ever happen again. We know we can do better, and we shall do better. Thank you for your understanding and support, and we hope that despite this glitch, we still see you in our future webinars. Stay safe, everyone. Shiny, back to you.
All right, thank you, Dr. Art. So I hope everyone that you were able to gain some helpful knowledge about how to maintain our mental health in the workplace. So this is our very first MaxiCare Maxi Life webinar series, and please don't forget to join us again next time. That will be next week as we discuss another interesting topic about the 5 stages of coping with the present times. So, okay, have a great day, everyone. See you soon. Bye.
parang nariyan lang. MaxiCare.
What makes a future special? Perhaps it's in what you see. And how we see it. What you hear and how we listen. And if you seek a future that's worth depending on, we've got you covered in every way. We even added a little cup of comfort. And tasteful little details to show how much you mean to us. We are moving forward. Innovating our touch of care. Making us available at any hour, at any day. So we can be more responsive. So we can be more connected. This is how we make the future of healthcare special. By making you experience you are special in every sense. We go beyond care. Experience MaxiCare today. MaxiCare Primary Care Clinic VGC is open to care for you 24 hours a day, every day. Visit other MaxiCare primary care centers at these locations.
Pag biglang nagkasakit, sagot ka ng e-Ready. Ang first prepaid emergency health card from MaxiCare. Sagot ang anumang sakit, sagot din ang sakit sa bulsa. Pag emergency, sagot ka ng MaxiCare e-Ready. Pag na-aksidente, sagot ka ng e-Ready, ang first prepaid emergency health card from MaxiCare. Sagot ang sakit ng katawan, sagot din ang sakit sa bulsa. Pag emergency, sagot ka ng MaxiCare e-Ready.
bring you luck or change your luck. Fight the 8 deadly diseases: dengue, malaria, pneumonia, and more. With My MaxiCare Lite, the one-time prepaid health card for hospital confinement due to the 8 deadly diseases. So luck is always on your side. Fight the 8 with My MaxiCare Lite.
Si Mama, unlimited ang pagmamahal.